disabilities, and teachers would need training to better understand the condition, including helping pupils with Down syndrome to improve their speech and language and helping them to reach their optimal communication, as well as ensuring that all children can access the curriculum. I have so many parents that complain to me in my constituency that they have to fight sometimes for an education and healthcare plan, and it is shocking that there are children with Down syndrome, which is a well-known disability, learning disability, with a well-known need for good early educational intervention without a full-time ECP, and some even don't have them at all. Not having a plan means that the right provisional support system is not available or even have no support whatsoever. Research shows that mainstream schooling has better outcomes for children who have Down syndrome, and that students with Down syndrome gain academic, social and behavioural advantages from being educated with their typically developing peers in mainstream school. With appropriate support and accommodations, students with Down syndrome can benefit from mainstream schooling, and inclusive education has benefits for all students. My daughter, who's now an adult, had the joy of going to primary school with a classmate who had Down syndrome. She enriched her classmates' lives, and as they all got older and started to notice that she was different, they did not treat her any differently. To them, she was her, and absolutely perfect as she was, someone they had happily grown up with. As they got older, it also helped them to be more caring and considerate. Unfortunately, their friend was not allowed to stay with her friends beyond middle school. This was not only sad for her and her family, but really was a loss for her friends and the school's loss. I also want to just briefly highlight the lack of job opportunities, as has been highlighted, for people with Down syndrome. There are around 40,000 people with Down syndrome living in the UK, and only 6% are employed. 6%. Think of the isolation and loneliness of the 94%. I want to take this opportunity to thank Littlegate Farm and all the work they do in helping and supporting people with learning disabilities near me. This bill will aim to improve employment rates for adults with Down syndrome, and we need to unleash the potential of everyone, including people with Down syndrome, to give them the opportunity of showing us all what they are truly capable of and ensuring they get the same chances as everyone else. This is about levelling up individuals. It is right and just to give people with Down syndrome recognition of their specific needs and give them the dignity of a human person. It is never too late to be who you want to be, and never the wrong time to do the right thing.
Thank you. I am just delaying for a few seconds so that we can have a perfect transition to 11 o'clock, at which point, order. Under the terms of Standing Order number 11.4, I'm interrupting proceedings for a ministerial statement. I call the Secretary of State for Health, Sajid Javid.
Thank you, Madam Deputy Speaker. With permission, I'd like to update the House on COVID-19, but before I begin, I want to wish the Shadow Secretary of State well as he recovers from COVID-19. Madam Deputy Speaker, over the past 48 hours, a small number of cases of a new variant have been detected on our international genomic database. I want to reassure this House that there are no detected cases of this variant in the UK at this time. But this new variant is of huge international concern. The World Health Organization has called a special meeting this morning, and that meeting is taking place right now. I want to update the House on what we know so far, why we're concerned, and the action that we are taking. Although I must stress that this is a fast-moving situation, and there remains a high degree of uncertainty. The sequence of this variant, currently called B11529, was first uploaded by Hong Kong from a case of someone travelling from South Africa. The UK was the first country to identify the potential threat of this new variant and to alert international partners. Further cases have been identified in South Africa and in Botswana, and it is highly likely that it is now spread to other countries. Yesterday, the South African government held a press conference where they provided an update on what they know so far. I want to put on record my thanks to South Africa, not only for their rigorous scientific response, but the openness and transparency with which they have acted, much as we did here in the United Kingdom when we first detected what is now known as the Alpha variant. Madam Deputy Speaker, we are concerned that this new variant may pose substantial risk to public health. The variant has an unusually large number of mutations. Yesterday, the UK Health Security Agency classified B11529 as a new variant under investigation, and the Variant Technical Group has designated it as a variant under investigation with very high priority. It's the only variant with this designation, making it higher priority than Beta. It shares many of the features of Alpha, Beta, and Delta variants. Early indications show this variant may be more transmissible than the Delta variant, and current vaccines may be less effective against it. It may also impact the effectiveness of one of our major treatments, Ronapreve. Madam Deputy Speaker, we're also worried about the rise in cases in countries in Southern Africa, especially as these populations should have significant natural immunity. In South Africa in particular, there has been exponential growth, with cases increasing fourfold over the last 2 weeks. In Gauteng province, which includes Johannesburg and Pretoria, some 80% of cases, when tested with a PCR test, have shown something that is known as the S-gene dropout, which we associate with this variant. So while we don't know yet definitively whether the exponential growth in South Africa is directly associated with this new variant, this PCR test analysis does indicate that there could be many more cases of this new variant than just those that have been sequenced so far. So, Madam Deputy Speaker, even as we continue to learn more about this new variant, one of the lessons of this pandemic has been that we must move quickly and at the earliest possible moment. The UK remains in a strong position. We've made tremendous gains as a result of the decisions that we took over the summer and the initial success of our booster programme. But we're heading into winter, and our booster programme is still ongoing, so we must act with caution. So we're taking the following steps. Yesterday, I announced that from midday today, we're placing 6 countries in Southern Africa on the travel red list. These countries are South Africa, Botswana, Lesotho, Eswatini, Namibia, and Zimbabwe. Anyone who is not a UK or Irish resident who has been in one of these countries in the last 10 days will be denied entry into England. UK and Irish residents arriving from these countries from 4 a.m. on Sunday will enter hotel quarantine. Anyone arriving before those dates should take PCR tests on day 2 and day 8, even if they are vaccinated, and isolate at home along with the rest of their household. If you've arrived from any of these countries in the last 10 days, NHS Test and Trace will be contacting you and asking you to take PCR tests. But please, do not wait to be contacted. You should take PCR tests right away. We've been working closely with the devolved administrations on this, and they will be aligning their response. In recent hours, Israel has also taken similar precautions. Madam Deputy Speaker, I wish to stress that we're working quickly and we're working with a high degree of uncertainty. We are continuing to make assessments, including about those countries with strong travel links to South Africa. And we are working with our international partners, including South Africa and the European Union, to ensure an aligned response. But this variant is a reminder for all of us that this pandemic is far from over. We must continue to act with caution and do all we can to keep this virus at bay, including, once you are eligible, getting your booster shot. We've already given over 16 million booster shots. The booster jab was already important before we knew about this variant, but now it could not be more important. So please, if you are eligible, get your booster shot. Do not delay. Madam Deputy Speaker, we've made great progress against this virus, progress that we are determined to hold on to. This government will continue to do whatever is necessary to keep us safe, and we've all got our part to play. I commend this statement to the House.
Alex Norris.
Thank you, Madam Deputy Speaker, and I thank the Secretary of State for advance incisive statement and for his kind words about the Shadow Secretary of State, which we would all share on this side of the House too. Now, we have been critical of the government in the past for taking too long to protect our borders from new variants, particularly when Delta was left to run free. So we are glad to see swift action today. Adding these countries to the red list is the right call, and we support it. I wonder if the Secretary of State might explain why it's these specific countries added and not the wider group where cases of this variant have been detected, and whether the addition of further countries is under active consideration over the coming days, but that perhaps in the meantime we might, at least for countries not on the red list but have cases, require PCR tests on arrival rather than lateral flow ones. We have made, as the Secretary of State says, great strides in getting people vaccinated in this country, but we've always warned that no one will be safe until everyone is safe. And it is regrettable that when we offered plans to the government earlier around global expansion of vaccination, those weren't taken up. And today's news does reflect a failure of the global community to distribute the vaccine, with just 5.5% of people in low-income countries being vaccinated. So could the Secretary of State tell us about the work he'll be doing with his counterparts in affected countries to make sure that they have the vaccines and the infrastructure to deliver them? And can he give us the assurance that our cuts to aid that we've made in this country will not affect that? And would he share with us our regret that we had to destroy 600,000 expired doses of the vaccine in August, and what we're doing to make sure our stockpiles get to other countries who need them? Turning to testing, Madam Deputy Speaker, earlier this month capacity went down significantly, with members of the public reporting that their local centres had closed. Would the Secretary of State reassure us that testing still will be an integral part of our approach, and can he take this opportunity to refute the rumours that test and trace will be scaled down further? This is also a reminder, Madam Deputy Speaker, that we need to go further and faster with vaccination at home. Children's vaccination rates remain low. The progress on the booster is, of course, welcome, but we know to get there by Christmas we need to go even quicker. And there are, of course, huge pockets of the country where significant numbers of people remain unvaccinated. 40% of people, for example, in Nottingham, 38% in Wandsworth, 30% in Bolton. And the message that the Secretary of State had for those people today, I think, was a very important one, because this is a reminder that COVID has not gone away. So will the Secretary of State make commitments to fix sick pay, which is still necessary 19 months on? And will he go further to ensure that public buildings, schools and businesses have the support they need? And surely, Madam Deputy Speaker, we must now revisit cost-free measures such as mask wearing in public spaces. Madam Deputy Speaker, to conclude, this is a sobering reminder of the challenges that this pandemic brings. And we must meet this moment, as we have throughout the last 19 months, by pulling together, by looking out for each other, and in that British spirit of doing what must be done. Thank you.
Secretary of State.
Madam Deputy Speaker, I'm pleased to respond to the Shadow Minister. His first question was around the countries, the 6 countries that we have decided to put on the red list from midday today. We are going by primarily about where this new variant has been detected at this point, and that's been confirmed in 2 countries in Southern Africa, and that's South Africa and Botswana. We've included the 4 other countries that I mentioned earlier in Southern Africa, as a precaution. And I think the Shadow Minister won't be surprised to know that we are keeping this under review, and there's very live discussions going on around whether we should and when we might add further countries, and we won't hesitate to act if we need to do so. In terms of the vaccine donations to developing countries, the Shadow Minister is absolutely right about the importance of this. He will know that the UK has, for a country of its size, has done far more than any other country in the world. Already over 30 million donations. We are absolutely committed to our 100 million target, and we will continue to work bilaterally with countries, but also through the COVAX alliance to get out more vaccines to the developing world. Testing remains a hugely important part of our response to this pandemic. It's playing an incredibly important role, and that will continue for as long as is necessary. And then lastly, on the vaccinations, of course, that is the primary force, the primary form of defense in our country. In one sense, we are fortunate with such a high level of vaccination. Over 80% of people over the age of 12 have been double vaccinated, 88% at least a single vaccination. That's one of the highest in the world. But we need to go further, and we need to go even faster. And it is great news that our booster program at over 16 million jabs across the UK is the most successful in Europe. Now I believe over 26% of the population over the age of 12. But we would want more and more people to come forward as soon as they're eligible, and I can't stress the importance of that enough. And today, as he said at the end of his remarks, it is a sober reminder that we are still fighting this pandemic, and we can all play a part.
Dr. Liam Fox.
Deputy Speaker, the viral mutation process of genetic drift depends on the number of times a virus gets to replicate. So the wider the spread geographically and the longer that it goes on, the more viral replications will occur and the more chances there will be for mutations. So there is a need to redouble our efforts to vaccinate populations right across the globe. My right honourable friend mentioned the potential increased transmissibility of this virus, but there's another important element, which is the severity of the illness produced by a variant. What do we know about it so far, and the potential, therefore, for impact on the health service?
Secretary of State.
And Deputy Speaker, as always, the analysis that provided by my right honourable friend is absolutely correct. In terms of the severity of this new variant, I'm afraid we don't know enough yet. From what we can tell from let's call it a desktop analysis, given the number of mutations that have been identified, you double those that were there for the Delta variant, it does indicate that there's a possibility that it might have a different impact on an individual should they get infected. But as I said earlier, there's a lot we don't know about this, and we are working with our international partners to find out more.
Rachel Maskell.
Thank you, Madam Deputy Speaker. I thank the Secretary of State for his statement today, and also for emphasising the importance of vaccination. However, his statement does make clear that we are seeing new variants and the risks still remain, and therefore taking further public health measures is really, really important. And therefore I ask him again whether or not he can give very clear leadership around ensuring that face coverings, social distancing and high hygiene are instituted, as well as better ventilation, because these measures do make a difference, as we have seen throughout the last 2 years.
Secretary of State.
Madam Deputy Speaker, the Honourable Lady makes a good point about the need to follow guidance and the rules that are currently in place. The Plan A policies that we put in place, they remain the policies I think that we need at this time, but she won't be surprised to know that we do keep this under review, and if we need to go further, we will.
Sir Charles Walker.
Honourable gentleman opposite, the shadow spokesman for Her Majesty's opposition, mentioned the number of people who are unvaccinated. Please, Secretary of State, can we bring a nasal vaccine to market? Stage 2 trials are proving to be really, really good and positive with high rates of efficacy. If we've got to throw the kitchen sink at this, I cannot understand why we are not making nasal vaccines available. That will increase the uptake of vaccination in this country and across Europe.
Secretary of State.
My honourable friend is absolutely right to point to the importance of the continued importance of the vaccination programme, and there are some 5 million people in the UK that haven't even received a single shot of any type of vaccine. He's right to talk about the importance of the methods of delivery of a vaccine, and as he's mentioned, there are trials of nasal vaccines, but I'm sure he'll understand until such vaccines are approved by our independent regulator, we would not be able to pursue them.
Pat McPadden.
Thank you, Madam Deputy Speaker. I'd like to thank the Secretary of State and the NHS and everyone who is responsible for the booster programme that's helping to protect us as we enter the winter months. But isn't one of the lessons of the news that he's announced today that if we don't tackle the enormous vaccine inequality around the world, we're going to continue to be exposed to new variants of this type? In Africa, for example, just 6.6% of the population have been vaccinated. Now, of course, it's every government's first duty to protect its own people. Everyone understands that. But does the Secretary of State agree that the United Kingdom and other rich countries in the world must do more to ensure that surplus doses that we don't need are distributed to countries that do need them, rather than not being used and ultimately, in some cases, being destroyed?
Secretary of State.
Madam Deputy Speaker, I very much agree with every word of the honourable gentleman, especially around the surplus vaccines, and that is exactly what we have done. Whenever we have identified vaccines that we may not need, we have offered them either bilaterally or through the COVAX programme, and we will absolutely continue to play our role, but also, very importantly, we will continue to urge our international partners to do all they can as well.
John Lamont.
Thank you very much. I commend the government for the speed at which they have taken this decision. I also welcome the fact that the Scottish Government is following suit, because in the past there has been concern about the lack of consistency across the UK. But does the Health Secretary agree with me that this is a useful reminder that the pandemic is still with us and we all have a responsibility to get vaccinated, and that includes getting the booster?
Secretary of State.
So, first, I can tell my honourable friend that there's been excellent coordination across the UK on this. And as I mentioned earlier, that Scotland and all parts of the UK will be aligning themselves with what I have announced. But the importance of the booster programme, as I say, cannot be more important. In fact, the very latest figures are 28.5% of the UK population of the age of 12 has been boosted, by far and away more than any other country in Europe. I think second only to the United States. But it's still not enough. We need everyone to come forward. And if there are people out there listening that are thinking, what can they do? The single most important thing they can do is, if they are eligible for booster, go and get it. In fact, go out this weekend and make it your booster weekend.
Meg Hillier.
Thank you, Madam Deputy Speaker. Madam Deputy Speaker, I appreciate that the Secretary of State has come to the House at the earliest opportunity and his swift action, and I hope this indicates the way he will engage with us all on this vital issue. I wonder if he's had any indication from South Africa and the other South African nations of Southern Africa that he mentioned about the impact on children of this variant, and whether there are any plans to offer second doses to children here in the UK.
Secretary of State.
Madam Deputy Speaker, it's a very good question from the Honourable Lady. And first of all, I have to, at this point in time, this has moved so fast, we have not had any indications about the potential impact of this new variant on children in particular. It is something, as soon as we can find out, we will want to share. In terms of the UK, the child vaccination programme, it is going well across the UK. It's been building up a significant momentum. But as for whether second doses would be recommended, we would await for the expert advice of the JCVI.
Suzanne Webb.
Thank you, Madam Deputy Speaker. I welcome the swiftness of the government's response to this new variant under investigation. Can my right honourable friend confirm that as the situation develops, the government will continue to move at the earliest possible opportunity?
Secretary of State.
Yes, I can absolutely make that commitment to my honourable friend, and she will perhaps know already from the information the government shared. We only identified the significance of this variant just 2 or 3 days ago. And we didn't hesitate to take action because, as we've always said, we will protect our borders when it comes to this pandemic.
Lillian Greenwood.
Thank
you, Madam Deputy Speaker. As the Secretary of State has reiterated, getting vaccinated is vitally important. I'm looking forward to getting my booster jab tomorrow. But he knows that some groups and some communities are more hesitant, more fearful about being vaccinated. And I'm really conscious both that vaccination rates in Nottingham City are below those in the wider county and that our local health services are already under huge pressure. So can the Secretary of State set out what he's doing to drive up vaccination rates in areas where there's been low take-up, and will he now offer places like Nottingham additional support as we head into winter?
State.
Madam Deputy Speaker, I want to make sure all the support that is needed for our vaccination programme is there across England. And she asks the Honourable Lady quite rightly, what are we doing to reach out to those that have, for whatever reason, so far been a bit hesitant? We are working actively now for months with many community leaders. We have added many more venues and ways to actually receive the vaccine, so improved access. And there's significant work on communications and reaching out and making sure the right messages are there, and also people available, including clinicians, to answer questions. But she's absolutely right to point to the importance of this, and I'm pleased to hear that she'll be getting boosted this weekend.
Sir Christopher Chu.
Madam Deputy Speaker, ivermectin has shown promising results as a potential treatment for COVID-19, including in South Africa. Over 5 months ago, ivermectin was added to the Oxford University trial called Principle. When will the results from that trial be available? And what is the government doing to expedite the process? Because ivermectin may not be a magic bullet, but it may be.
Secretary of State.
Friend makes a very important point there. One thing that is different about dealing with this pandemic today than even a year ago is that we already do have more treatments. And my honourable friend mentions another potential new treatment. I'm afraid there's no exact date that I can share with him about when we think the trials will be over. But I'm pleased that these trials are taking place. He's right to point out the potential of this treatment. But I can reassure him that whether it's with ivermectin or other potential new treatments, the UK could not be more engaged.
Ruth Jones.
Thank you, Madam Deputy Speaker, and I thank the Secretary of State for coming to the House today to give us this statement so urgently. There were a number of high-profile sporting events due to have taken place in South Africa this coming weekend, including the United Rugby Championship, in which Cardiff and the Scarlets rugby teams are due to play. So what assistance has been given to them to get them home ahead of the midday deadline today? And also, what discussions has the Secretary of State had with the devolved administrations to ensure a coordinated, orderly introduction of the new travel restrictions?
Secretary of State.
So Madam Deputy Speaker, first of all, I understand whether it's sports teams or the thousands of British tourists and others that are currently find themselves in South Africa, Botswana, or any of these countries. This is very difficult news, but I hope that many will understand. Indeed, I've had messages today from people that are in South Africa, and it's made their life a bit more difficult getting back home, but they fully understand and support the action that has been taken. As for her particular question around the team